In the sterile hallways of Columbia University Irving Medical Center, where hope and despair dance their eternal waltz, Dr. Kim had seen it all. 20 years of surgical experience had taught him that medicine was not just about cutting and healing. It was about touching souls at their most vulnerable moments. Today, like every other day, he walked these corridors with the weight of lives in his hands, knowing that each patient carried a story that could change everything. But some stories would test even his legendary skills and unwavering determination. Karen Diamond was 50 years old when her world tilted on its axis. A vibrant woman with 3 children and a loving husband, she had always been vigilant about her health. With dense breast tissue, a family history of cancer, and multiple risk factors, she knew the statistics weren't in her favor. Still, nothing could have prepared her for what February 1st, 2018, would bring. Dr. Kim, his resident, approached him that morning, holding a mammogram report with trembling hands. "We have a new case. 50-year-old female, abnormal 3D mammogram results. The patient is requesting to see you specifically." Dr. Kim paused, his experienced eyes already reading between the lines of medical jargon. He had built his reputation not just on surgical precision, but on seeing what others missed, on finding hope where others saw only darkness. His colleagues called him Dr. Miracle, but he knew that miracles were just medicine performed with absolute dedication and relentless innovation. What Dr. Kim didn't know was that this case would challenge everything he believed about timing, treatment, and the cruel mathematics of cancer recurrence. Karen's journey would become a testament to the power of early detection, cutting-edge technology, and the kind of medical partnership that transforms patients from statistics into survivors. The phone call came just 20 minutes after Karen left her routine mammogram appointment. In that brief moment, her life divided into before and after. Before the call, she was a healthy woman planning her day. After the call, she became a cancer patient facing an uncertain future. But this is not just a story about cancer. It's a story about choice, courage, and the extraordinary lengths one doctor would go to save not just a life, but a woman's sense of wholeness and hope. Are you ready to witness how early detection, innovative treatment, and an unbreakable doctor-patient bond can turn a devastating diagnosis into a story of triumph? Subscribe and join us as we follow Karen and Dr. Kim through a medical journey that would test them both in ways they never imagined. The morning sun streamed through the hospital windows as Dr. Kim prepared for what would become one of the most challenging cases of his career, not because of its complexity, but because of what it would teach him about resilience, timing, and the unpredictable nature of hope. Dr. Kim was reviewing surgical notes when his phone buzzed with an urgent message from the radiology department. A 3D mammogram had revealed something that demanded immediate attention. As he walked toward his office to prepare for the consultation, he reflected on how technology had transformed breast cancer detection. The new 3D mammography was revolutionary, capturing images from multiple angles to create a comprehensive picture that traditional 2D mammograms simply couldn't match. Karen Diamond sat in the consultation room, her husband Michael by her side, both trying to process the whirlwind of the last few hours. The callback had come so quickly after her mammogram that she barely had time to feel anxious before finding herself back at the medical center, undergoing additional tests. "Mrs. Diamond." Dr. Kim entered the room with his characteristic calm presence that had reassured thousands of patients over the years. "I've reviewed your imaging results, and I want to discuss what we've found." Karen squeezed Michael's hand tighter. She had always known this moment might come. Her great-aunt's death from breast cancer at a young age had cast a long shadow over her family's medical history. Combined with her Ashkenazi Jewish heritage, early menstruation, and dense breast tissue, she carried multiple risk factors that made regular screening not just recommended, but essential. "The good news," Dr. Kim continued, his voice steady and reassuring, "is that we caught this very early. The tumor is small, no bigger than 2 centimeters, and appears to be stage 1. This gives us excellent treatment options." Dr. Kim had seen too many patients whose cancers were discovered too late, when options were limited and outcomes uncertain. But Karen's diligent approach to screening had created an opportunity. The 3D mammogram had detected what a traditional 2D scan might have missed, especially in dense breast tissue like hers. "What does this mean for treatment?" Michael asked, his voice barely concealing his worry. Dr. Kim pulled out his tablet and began sketching, a habit that had made him legendary among patients for his ability to make complex medical concepts accessible. "We have several options. We can perform a lumpectomy, removing just the tumor and a small amount of surrounding tissue. We can also discuss mastectomy if that's your preference. But what makes your case particularly interesting is that you're an excellent candidate for something relatively new called intraoperative radiation therapy. Karen leaned forward, intrigued despite her fear. What's that? Traditional radiation therapy involves weeks of daily treatments after surgery, Dr. Kim explained, his pen moving across the paper as he drew. Intraoperative radiation, IORT, allows us to deliver targeted radiation directly to the tumor site during surgery in a single dose. It's precise, efficient, and preserves more healthy tissue. The room fell silent as Karen and Michael absorbed this information. Dr. Kim had learned that these moments of silence were crucial. Patients needed time to process, to feel their emotions, to ask the questions that mattered most to them. "Doctor," Karen finally spoke, "I want to save my breast if possible. This intraoperative radiation, it sounds like it might be the best option for me." Dr. Kim nodded, impressed by her composure and clarity. "I believe it is, but I also want you to get a second opinion. This is too important a decision to make without exploring all your options." As Karen and Michael left the consultation room, Dr. Kim remained behind, studying her scans once more. Something about this case felt significant, though he couldn't yet put his finger on what it was. The second opinion appointment took place at another major medical institution, one with an excellent reputation for cancer care. Karen and Michael drove there with a mixture of hope and apprehension, carrying Dr. Kim's detailed notes and imaging results. The consulting oncologist, Dr. Sarah Mitchell, was thorough and professional. She reviewed Karen's case meticulously, explained the standard treatment protocols, and discussed the benefits and risks of various surgical approaches. However, when Karen asked about intraoperative radiation therapy, Dr. Mitchell shook her head. "We don't offer IORT here," she explained. "It's still relatively new, and we prefer to stick with proven protocols. Standard radiation therapy after lumpectomy has decades of research supporting its effectiveness." Karen felt a sinking sensation. Here was a major cancer center with world-renowned doctors, and they were essentially telling her that the innovative treatment Dr. Kim had offered wasn't necessary or available. "What about if the cancer comes back?" Michael asked. "Would we still have options?" Dr. Mitchell reviewed the imaging again. "Given the small size and early stage, recurrence is unlikely. But if it did happen, we would reassess at that time. The important thing now is to remove the tumor and follow up with standard radiation therapy." The drive home was quiet, both Karen and Michael lost in their thoughts. The traditional approach felt safe, familiar, backed by years of research and countless success stories. But something about Dr. Kim's innovative approach resonated with Karen's instinct to be proactive about her health. Back at Columbia, Dr. Kim was preparing for surgery on another patient when his nurse approached with a message. "Mrs. Diamond called. She wants to schedule her surgery with you. She said she's ready for the IORT procedure." Dr. Kim felt a familiar surge of satisfaction mixed with responsibility. Every patient who chose innovative treatment was placing their trust not just in his surgical skills, but in his judgment about emerging technologies. IORT wasn't experimental, but it was newer, and with innovation always came the weight of being among the first. That evening, Dr. Kim called Karen personally, a practice that had earned him the loyalty of countless patients and families. "Mrs. Diamond, I'm honored that you've chosen to proceed with surgery here. I want you to know that I believe IORT is the right choice for your specific situation. The tumor is small, well-contained, and positioned perfectly for this approach." Karen's voice was steady but emotional. "Dr. Kim, from the moment we met, I felt like you saw me as a whole person, not just a medical case. When you drew those pictures and explained everything so clearly, I knew you were the right doctor for me." "The surgery is scheduled for the 3rd week of March," Dr. Kim continued. "My team and I will take excellent care of you. And Karen, I want you to know that choosing IORT now keeps all your future options open. If anything ever happens down the road, which I don't expect, you'll still have the full range of treatments available." Neither of them could have predicted how prophetic those words would prove to be. Dr. Kim spent the next few weeks refining his surgical plan, studying Karen's imaging from every angle, and coordinating with the radiation oncology team that would deliver the IORT during surgery. This multidisciplinary approach was what he loved most about modern cancer care, the collaboration between specialists that gave patients the best possible outcomes. As March approached, Karen continued her normal routines while mentally preparing for surgery. She had told her 3 children about the diagnosis in age-appropriate ways, emphasizing that they had caught it early and that the treatment would fix the problem. "Mom's going to be fine," she had assured them. "The doctors know exactly what to do." The night before surgery, both Dr. Kim and Karen found themselves unable to sleep, each carrying their own hopes and fears about what the morning would bring. March 21st, 2018, dawned clear and bright, a good omen, Karen thought as she prepared for surgery. Michael drove her to the hospital in comfortable silence, both of them feeling surprisingly calm despite the magnitude of what lay ahead. In the preoperative area, Dr. Kim made his rounds, visiting each patient personally before their procedures. When he reached Karen's bedside, he found her reading a book, remarkably composed for someone about to undergo cancer surgery. "How are you feeling, Karen?" he asked, noting her steady vital signs on the monitor. "Surprisingly peaceful," she replied honestly. "I keep thinking about how lucky I am that we caught this so early, that I have options, that I found you." She paused, looking directly at him. "Dr. Kim, I trust you completely. Do what you need to do." Those words carried weight that went beyond their simplicity. In his 20 years of practice, Dr. Kim had learned to distinguish between patients who were merely compliant and those who had truly formed a partnership with their medical team. Karen belonged to the latter group, and it made all the difference. The operating room was a symphony of controlled activity. The surgical team had prepared meticulously for the IWART procedure, with specialized equipment positioned precisely around the operating table. The radiation oncology team stood ready to deliver the targeted therapy the moment Dr. Kim gave the signal. "Beginning lumpectomy," Dr. Kim announced as he made the initial incision. His hands moved with the precision that had earned him his reputation, carefully navigating around healthy tissue to reach the tumor. The tumor was exactly where the imaging had indicated, small, well-contained, and perfectly positioned for the innovative treatment they had planned. As Dr. Kim carefully removed it, he felt the satisfaction that came with surgical precision, but also the weight of responsibility for what came next. "Margins look excellent," he reported to the team. Proceeding to lymph node sampling. The lymph nodes, those crucial indicators of whether cancer had spread beyond its original location, were carefully examined under the microscope while Karen remained under anesthesia. Dr. Kim waited tensely for the pathologist's report, knowing that these results would determine not just the immediate success of the surgery, but Karen's long-term prognosis. All lymph nodes negative for malignancy. Came the report that Dr. Kim had been hoping to hear. Now came the innovative part of the procedure. The radiation oncology team moved into position with their specialized equipment, ready to deliver precise radiation directly to the surgical site. This was the beauty of IORT. Instead of weeks of external radiation that would affect healthy tissue, they could target the exact area where the tumor had been with surgical precision. "Radiation therapy commencing," announced Dr. Sarah Chun, the radiation oncologist who had become Dr. Kim's trusted partner in these procedures. The targeted radiation lasted only minutes, but those minutes represented the culmination of years of research and innovation. Dr. Kim watched the monitors carefully, ensuring that every aspect of the procedure was proceeding according to plan. "Radiation complete. Excellent placement and coverage," Dr. Chun reported. Dr. Kim began the careful process of closing the surgical site, taking extra care with the cosmetic aspects of the procedure. He knew that for Karen, preserving the appearance and integrity of her breast was almost as important as removing the cancer. In the waiting area, Michael paced nervously, checking his phone repeatedly for updates. When Dr. Kim finally emerged from the operating room, his expression told the story before his words did. "The surgery went perfectly," Dr. Kim announced. "We removed the entire tumor with excellent margins. All lymph nodes are negative, and the IWART was delivered exactly as planned. Karen is going to be fine." Michael's knees nearly buckled with relief. "And her breast?" "Saved," Dr. Kim smiled. "She'll have a slightly larger scar than with traditional surgery because of the radiation effects, but it will fade with time. Most importantly, we've given her the best possible chance for a complete cure." As Karen awakened in the recovery room, she felt not just relief, but a profound gratitude for the precision and care that had preserved both her life and her sense of wholeness. Recovery from the IWART procedure was remarkably smooth. Karen experienced minimal discomfort, and within 10 days, she was well enough to travel on a vacation she and Michael had planned months earlier. The speed of her recovery amazed even Dr. Kim, who had performed hundreds of similar procedures. The beauty of IORT, he explained to his residents during their weekly case review, is that we eliminate weeks of daily radiation appointments. Patients can return to their normal lives much more quickly. Karen's case had become a teaching example in the department, not because it was complex, but because it demonstrated the potential of combining early detection with innovative treatment. The 3D mammogram had caught a cancer that might have been missed by traditional imaging, and IORT had provided treatment that preserved both breast tissue and quality of life. As part of her follow-up care, Karen began taking tamoxifen, a daily medication that would reduce her risk of cancer recurrence by 50% over the next 5 years. The small pink pill represented modern medicine's ability to not just treat cancer, but to prevent it from returning. "I feel like I've been given a second chance," Karen told Dr. Kim during her 3-month follow-up appointment. "The scar is already fading, and honestly, most days I forget this even happened." Dr. Kim smiled, but internally, he remained vigilant. He had learned never to become complacent about cancer, even with the most successful treatments. "I'm thrilled with your recovery, Karen. Keep taking the tamoxifen, and we'll see you for your 6-month mammogram in August." August arrived with the oppressive heat of a New York summer. Karen approached her 6-month mammogram with confidence, expecting it to be a routine confirmation that she remained cancer-free. She had been diligent about taking her medication, had recovered completely from surgery, and felt better than she had in months. The mammogram appointment felt different from the beginning. The technologist seemed to be taking more images than usual, repeatedly repositioning Karen for additional views. After the initial imaging, Karen was asked to wait while the radiologist reviewed the results. Dr. James Rodriguez, the radiologist, studied the images with growing concern. There, on the opposite side of the same breast where Dr. Kim had performed the lumpectomy just 6 months earlier, was another abnormality. It was tiny, much smaller than the original tumor, but definitely suspicious. The call came that afternoon while Karen was at work. This time, she was prepared for the possibility of bad news, but the reality still hit her like a physical blow. "Mrs. Diamond, we need you to come in for additional imaging," the nurse explained. "Dr. Kim wants to see you as soon as possible." The drive to the hospital felt surreal. How could this be happening again, so soon after successful treatment? Karen had done everything right, followed all medical advice, taken her medication religiously, maintained a healthy lifestyle. Yet here she was, facing the possibility of cancer again. Dr. Kim met with Karen and Michael that same afternoon, his expression serious but not defeated. "The imaging shows what appears to be ductal carcinoma in situ, or DCIS, in the same breast but on the opposite side from your original tumor." "What does that mean?" Michael asked, his voice tight with worry. "DCIS is the earliest possible form of breast cancer," Dr. Kim explained. "It's abnormal cells confined to the milk ducts before they've had a chance to spread. Under normal circumstances, we would simply remove it surgically and be done. No radiation would be necessary." Karen felt her heart sink. "But these aren't normal circumstances." "No," Dr. Kim said gently. 2 cancers in the same breast, 6 months apart, changes the equation entirely. The cruel mathematics of cancer recurrence were about to test everything Dr. Kim believed about patient care, innovative treatment, and the delicate balance between medical possibilities and human hope. The diagnosis of DCIS in the same breast, just 6 months after successful treatment of the original cancer, represented a medical complexity that challenged conventional wisdom. Dr. Kim found himself in uncharted territory, not because DCIS was unusual, but because the timing and location created a unique clinical scenario. "If this were your first cancer," Dr. Kim explained to Karen and Michael during their emergency consultation, "we would perform a simple lumpectomy to remove the DCIS and call it a day. No radiation, no additional treatment beyond regular monitoring." Karen's mind raced. "But because I've already had cancer in the same breast." "Exactly. 2 primary cancers in the same breast within 6 months suggests we need to be more aggressive in our approach." Dr. Kim pulled out his tablet and began sketching again, the familiar ritual that had guided them through the first diagnosis. The standard recommendation would be whole breast radiation therapy. Michael leaned forward, trying to understand the implications. "What about the IORT that worked so well the first time? Could we do that again?" Dr. Kim paused, considering his words carefully. This was where art met science in medical practice. where established protocols encountered individual circumstances that didn't fit neatly into textbook categories. That's actually a fascinating question, Dr. Kim said. Theoretically, IWART could work for this type of lesion. The problem is that we don't have data on using IWART twice in the same breast, especially with this timing. Karen's eyes lit up with possibility. You mean I could be the first? Dr. Kim couldn't help but smile at her enthusiasm, even in the face of a second cancer diagnosis. You could indeed be among the first. But that means we'd be in uncharted medical territory. I'm willing to be the guinea pig, Karen exclaimed, echoing the same courage and trust that had led her to choose IWART for her original treatment. Michael, however, looked concerned. Honey, maybe we should stick with proven treatments this time. The room fell silent as the weight of this decision settled on everyone present. Dr. Kim had built his reputation on being willing to push boundaries when it served his patients' best interests, but he also understood the responsibility that came with being first. Let me explain what we know and what we don't know, Dr. Kim said finally. We know that IWART is highly effective for small, well-contained lesions like your cysts. We also know that your breast tolerated the previous IWART procedure beautifully. What we don't know is how breast tissue responds to two IWART treatments in the same general area. Dr. Kim spent the next hour reviewing every aspect of Karen's case with his multidisciplinary team. The radiation oncologists, medical oncologists, and pathologists all weighed in on the unprecedented nature of her situation. The conservative approach would be standard whole breast radiation, advised Dr. Chen, the radiation oncologist. We know it works, and we know the side effects are manageable. But what if she needs radiation again in the future? Dr. Kim asked. If we use up her radiation tolerance now with whole breast treatment, and something else develops later, we'll have no options. This was the conversation that kept Dr. Kim awake at night, balancing current treatment needs against future possibilities, weighing proven protocols against innovative approaches that might serve patients better in the long run. After extensive discussion with his team and careful review of the medical literature, Dr. Kim made his recommendation to Karen and Michael. I believe whole breast radiation is the appropriate treatment for your current situation, he said. While I admire your willingness to be first, the timing of this second cancer, combined with the previous IWART, makes me cautious about pushing boundaries this time. Karen felt a mixture of disappointment and relief. Part of her wanted to continue pioneering innovative treatments, but another part recognized the wisdom in Dr. Kim's conservative approach. How many radiation sessions are we talking about? She asked. Given the small size of the cysts, we can use a shortened course, just 16 sessions instead of the typical 25 to 30, Dr. Kim explained. It's still a significant commitment, but much less than standard protocols. As they scheduled the second surgery and planned for radiation therapy, both Dr. Kim and Karen reflected on how medical journeys rarely follow the straight paths we expect them to take. The second surgery took place on a gray October morning, with autumn leaves swirling outside the hospital windows. Dr. Kim approached this procedure with the same meticulous preparation that had characterized the first surgery, but with an added layer of complexity born from the unique circumstances. The cyst lesion was exactly where the imaging had indicated, tiny, contained, and surgically accessible. As Dr. Kim carefully removed it, he reflected on the strange mathematics of cancer. How something so small could represent such a significant threat, and how timing could transform a simple procedure into a complex medical decision. Margins are excellent, he reported to his team. The cyst appears to be completely contained within the tissue we've removed. The pathology report confirmed what Dr. Kim had hoped. The abnormal cells were entirely confined to the milk ducts, with no signs of invasion or spread. Under different circumstances, this would have been the end of treatment. But circumstances were rarely simple in cancer care. Recovery from the second surgery was even smoother than the first, but Karen knew that the real challenge lay ahead. 16 sessions of whole breast radiation therapy meant 16 daily trips to the hospital, 16 exposures to radiation that would gradually accumulate in her breast tissue. The goal, explained Dr. Chen during Karen's radiation planning session, is to deliver enough radiation to eliminate any microscopic cancer cells that might remain, while preserving as much healthy tissue as possible. The radiation planning process was a marvel of modern technology. Using CT scans and computer modeling, the radiation team mapped Karen's breast tissue in 3 dimensions, calculating precise angles and doses that would target the cancer risk while sparing her heart, lungs, and healthy breast tissue. "We're going to take excellent care of you," Dr. Chin assured her. Most patients tolerate this treatment very well. The daily radiation sessions became part of Karen's routine. Each morning, she would drive to the hospital, change into a hospital gown, and lie on the treatment table while the massive machine delivered its precisely calibrated dose. The actual treatment took only minutes, but the cumulative effect would build over the course of the treatment. For 15 sessions, Karen felt nothing more than mild fatigue. She continued working, caring for her family, and maintaining her normal activities. The radiation team had prepared her to expect skin reactions, but they hadn't materialized. "I'm starting to think I'm invincible," she joked with the radiation technologists during her 14th session. It was after the 16th and final session that Karen discovered the meaning behind their warnings about delayed reactions. The day after completing radiation therapy, she looked in the mirror and saw what appeared to be a dramatic sunburn covering the treated breast. "Suddenly, it looked like I had been lying in the sun for a month on one side," she described to Dr. Kim during her follow-up appointment. The other breast was completely normal color. Dr. Kim examined the radiation reaction with the practiced eye of someone who had seen thousands of patients through similar treatments. "This is exactly what we expect to see," he assured her. "The skin will gradually return to normal, and any discomfort should resolve within a few weeks." The skin changes were dramatic, but temporary. Over the following month, the radiation-induced inflammation gradually subsided, the affected skin returned to its normal color, and the slightly thickened texture began to soften. "The most important thing," Dr. Kim reminded Karen during her 3-month follow-up, "is that we've addressed both cancers with treatments that preserve your future options. If anything else ever develops, which I don't expect, you'll still have the full range of therapeutic possibilities available." This concept of preserving future options would prove to be more prophetic than anyone realized at the time. Dr. Kim's decision to use IWART for the first cancer, rather than whole breast radiation, had made it possible to treat the second cancer with conventional radiation therapy. A different sequence of treatments might have left Karen facing mastectomy as her only option. As winter turned to spring, Karen approached her first mammogram since completing radiation therapy with a mixture of anxiety and hope, knowing that this test would reveal whether their comprehensive treatment approach had been successful. January 2019 arrived with the kind of bitter cold that makes New York City feel both harsh and beautiful. For Karen, this month marked a significant milestone, her first mammogram since completing radiation therapy for the second cancer. A full year had passed since that initial abnormal mammogram had changed her life, and she was about to find out whether their aggressive treatment approach had been successful. Dr. Kim had scheduled the appointment personally, knowing that this mammogram would carry psychological weight far beyond its medical significance. After 2 cancer diagnoses in 1 year, Karen deserved to hear good news directly from the doctor who had guided her through both treatments. The mammography suite felt familiar now. Karen had spent so much time there over the past year that the staff greeted her like family. The technologist who positioned her for the 3D mammogram was the same one who had discovered the original abnormality, and they chatted easily about Karen's children and her return to normal activities. But when the images appeared on the screen, both women fell silent. The mammogram was clear. Beautifully, completely, wonderfully clear. Dr. Kim reviewed the images with the kind of thorough analysis that had made him legendary in the department. He compared them to previous scans, looking for any subtle changes that might indicate residual disease or new developments. Every angle, every density, every shadow was scrutinized with the obsessive attention to detail that saves lives. "Perfect," he murmured to himself as he completed his review. "Absolutely perfect." When Karen and Michael arrived for their results appointment, they found Dr. Kim waiting with a smile that told the story before he spoke a word. "Your mammogram is completely clear," he announced. "No signs of cancer, no suspicious areas, no cause for concern whatsoever." The relief in the room was palpable. Michael closed his eyes and took his first deep breath in months, while Karen felt tears of joy that she had been holding back for over a year. "So we did the right thing?" Karen asked. "All those treatments, the surgeries, the radiation, it worked." "It worked perfectly," Dr. Kim confirmed. "But more than that, the sequence of treatments we chose has positioned you for long-term success. By using IWART for your first cancer, We preserved your option to use conventional radiation for the second cancer. If we had done conventional radiation first, the second cancer might have required mastectomy. This was the moment when the full wisdom of Dr. Kim's approach became clear. Medicine was often about making decisions with incomplete information, choosing treatments based not just on current needs, but on preserving future possibilities. What happens now? Michael asked. Now we monitor, Dr. Kim said. Regular mammograms, continued tamoxifen therapy, and the peace of mind that comes from knowing we've given you the best possible care. Karen left that appointment with a lightness she hadn't felt in over a year. The statistical probability of developing 2 primary breast cancers in the same breast within 6 months was extraordinarily low, but it had happened to her. The probability of successfully treating both cancers while preserving breast tissue and future treatment options was something that wouldn't have been possible even a few years earlier. That evening, Karen called her children with news they had all been waiting to hear. The tests are all clear, she told them. Mom is officially cancer-free. For Dr. Kim, Karen's case had become more than just a successful treatment outcome. It represented the power of combining cutting-edge technology, innovative treatment approaches, and the kind of doctor-patient partnership that transforms medical care from a series of procedures into a collaborative journey toward healing. As he updated Karen's medical record that evening, Dr. Kim reflected on what her case had taught him about the unpredictable nature of cancer and the importance of preserving hope alongside preserving treatment options. Some patients required textbook approaches. Others needed the kind of individualized care that pushed the boundaries of standard protocols. The clear mammogram results marked not just the end of Karen's cancer treatment, but the validation of an approach to medical care that prioritized both innovation and wisdom, both current needs and future possibilities. 3 years have passed since Karen Diamond's last cancer treatment, and her story continues to inspire both patients and medical professionals at Columbia University Irving Medical Center. Her annual mammograms remain clear, her health is excellent, and she has returned fully to the life that cancer briefly interrupted. Dr. Kim often shares Karen's case with medical students and residents, not as an example of dramatic surgical heroics, but as a demonstration of how early detection, innovative treatment, and thoughtful medical decision-making can transform potentially devastating diagnoses into stories of complete recovery. The key lesson from Karen's journey is not just about the importance of regular mammograms or the promise of new radiation technologies. It's about the power of partnership between patients and doctors who are willing to think beyond conventional approaches when individual circumstances demand it. Today, Karen advocates passionately for early detection and encourages other women to be as diligent about their health as she was about hers. If I had skipped even one mammogram, if I hadn't chosen 3D imaging, if I hadn't found Dr. Kim, she often says, my story might have been completely different. For Dr. Kim, Karen's case reinforced his belief that the best medical care comes from combining cutting-edge technology with old-fashioned human connection. Medicine is not just about treating diseases, he tells his students. It's about preserving hope, maintaining dignity, and ensuring that our patients can continue to live the lives they've built. The message for anyone facing a cancer diagnosis is clear. Early detection saves lives, innovative treatments preserve options, and the right medical partnership can overcome even the most challenging circumstances. Like Karen, you have the power to advocate for your health, seek out the best possible care, and never give up hope. Remember that every cancer story is unique, but every patient deserves the kind of comprehensive, compassionate care that turns medical crises into stories of survival and hope. Your health is your most precious asset. Protect it, advocate for it, and never hesitate to seek the innovative care that could change your life, just as it changed Karen's.